First of all, I must say that it is an extraordinary effort from all of you in Pratham USA to put together both the funding and, more importantly, the supply chain in place. So the machines have started rolling in the last few days. So as far as we are concerned here in India as Pratham Education Foundation, we have tied up with the Piramal Swasthya. That's the health initiative of Mr. Ajay Piramal, who is also the chairman of Pratham Education Foundation. So we are working with a broad number of 10,000 oxygen concentrators, and we have between us, unfortunately, Rukmani and Ramesh are not able to be on this call today, but Rukmani, our CEO, and Ramesh, a fellow board member, we have formed a 3-member team as far as deployment of oxygen concentrators are concerned. And there's a lot of back-end work that is being done by the rest of the Pratham team. And you have Nishant here, but there are other members of Pratham also who are doing good work as far as putting together all the data and also navigating through all the approvals and ensuring that things don't stay at one place but keep on moving. So deployment will be done using services of credible NGOs, and one of the clearing and forwarding agencies also has been identified by Pratham USA, and they are also providing a lot of help as far as making sure that the last mile is something that is met as far as logistics is concerned. We will learn a little later about how we intend to do monitoring in the following presentation. Also, we will be regularly providing updates both to Pratham USA and Pratham Education Foundation teams as far as these 8 to 10,000 oxygen concentrators are concerned. We can move to the next slide, please. So, as I was saying, Piramal Swasthya is spread across 7 states in India, primarily Assam, UP, MP, Jharkhand, Bihar, Rajasthan, and Maharashtra. So they have requested 1,800 of these oxygen concentrators to be deployed across these 25 districts itself where they are working. We have a concept in India of what are called aspirational districts. These are districts that have been, in some sense, been neglected or not developed as well as the rest of the country. And there is a lot of work in these aspirational districts also that Piramal Foundation has been able to do. There's another organization which is called Project Mumbai. So they have taken the responsibility of about 350 oxygen concentrators to be deployed in Mumbai and in Maharashtra. And another organization in rural Gujarat that has already come up for 40 oxygen concentrators. Many more proposals, including some of you from the US, have given us leads. So we will be working with some of them from Uttarakhand, other parts of Gujarat, Andhra Pradesh, West Bengal, Tamil Nadu as the time goes by. We can move to the next slide, please. So this is the process that we have published and we intend to stick to for the spirit of transparency. So step 1 is all the requests and assessments. So shortlisting for sharing is done with the selection committee. We want to ensure that we work with NGOs on the ground. So in different parts of the country, whether they are urban context or rural NGOs, we want to make sure that we work closely with them and ensure that these machines are distributed with the kind of expectation that any donor has, because we want to make sure that not only in this round, these machines are deployed well, but even going forward, God forbid, if there are any more such rounds, then in those waves also, we are able to deploy these machines. We can go to the next slide, please. So this is what has arrived already so far. So 500 of them arrived on 6th of May in Delhi, 12th, which is in the last one day, another 100 in Mumbai, and 250 have landed more in Delhi and Mumbai, which have been cleared today. And these again will be moving out starting tonight to tomorrow morning. And this have already been delivered, 500 of them in Delhi itself and 100 of them in Mumbai. So on an on-time basis, real basis, just like the purchase team that Raj talked of taking decisions, here we have a little bit longer uh, opportunity to know how the supplies and where they are landing and what sizes. And we have both the sizes, and that's what we are trying to do. I just want to also spend a couple of minutes and talk about what else can be done as far as the way forward is concerned. So the leg one of the strategy, which was rightly identified by Pratham USA in conjunction with Pratham Education Foundation, was oxygen concentrators. And that's where we have done, I think, fairly good work. What is now required as far as India is concerned is a set of medical equipments. Some of them are quite expensive, and we also need to make sure that we have people on the ground who can deploy them correctly. So whether they are PSA plants, whether they are oxygen cylinders, whether they are pediatric ventilators, whether they are BiPAPs and high flow nasal cannulas, HFNC machines. Besides that, as you know, Pratham works in many communities, but also does a lot of work as far as skill building is concerned. And in the last few days, we are discussing with some other partners, whether it's installation of medical equipments, whether running of the medical equipments is concerned, maintenance is concerned, and also repairs. If we can create a team of people who can, throughout the length and breadth of India, with the training that they get from the vocational centers of Pratham, we can create a cadre of people, and somewhere that will be equally important. Definitely we need money, definitely we need equipment and medical supplies, but we also need human resource to deploy these things. Another thing that's being talked about, and I'm sure the supplies will improve as far as vaccines are concerned, and Nishant will talk about that next, is the whole awareness bit as far as vaccine is concerned. And as they say, there is the AHA as far as the vaccine is concerned, A being availability, H being hesitancy, and A being administration. And these are the three critical steps that have again been identified by the public health officials. And a lot of work Pratham can do as far as that is concerned. And last but not the least, as we work with a lot of community partners as far as Pratham is concerned in the 15 to 20,000 communities, whether it's the protective uh, equipments, whether it's thermometers, whether it's oximeters and things like that. So some of the donations that we receive can also be used by locally procuring some things from India itself because it's available and ensuring it is distributed to all parts of the country. I'll just stop here. Thank you.